Mm, what's happening?
Good evening. How are you?
I'm all right. My bad.
It's okay. You
What's
would think
happening?
that you would think that I got more questions when you said we doing next week in 1 week than I get the whole 30
Really?
days. Yeah. I'm like, what is it about next week?
Oh, wow.
Or maybe it was the first of the year. People got a lot of stuff. I don't know, but I definitely got more questions this week than I feel like I get when it's a month apart.
That is interesting, but cool. That's why we here. My practice is actually in Chicago proper. It's now on the west side of Chicago. It's on 11th and Kedzie. Um, so 1108 South Kedzie is where my practice is at. Yeah, every Monday and Friday. And I operate still operate out of University of Chicago Ingles and now Mount Sinai. Let's get into it.
All right, so it looked like you had already kicked off the first question.
Yeah,
So
as
welcome,
long as
welcome back, everybody. It's only been a week. Tonight we are resuming some of the stuff we left off last week. I also got new submissions this week, a lot of them. So from new people. And if you want to ask a question, there is a question mark at the bottom of the screen with a bubble around it. If you can put it in there, that's easier because on the screen it scrolls. And if I have to scroll back and forth when people comment or write or talk to each other, it goes away. You can also request to join the live, which is like getting a free consultation on the spot. He can ask you everything that he needs to ask and give you the best feedback about your situation. Anything else you want to add?
that's it. It's free
Oh,
game.
if it's your
Free
first
game, as I
time,
said.
if it's your first time, I'm Cola Red. This is DocP. I'm one of his patients. I went through fibroid treatment over a year ago now, and we do this once a month because I shared my journey. It made an impact, and now we do this monthly to keep it going because it has a lot of people had questions about my journey, specifically their own journey and things of that nature. So we just keeping it going.
And everybody's like, for all the women that say, well, you don't know what it's like because you're not a woman and blah, 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 blah. Here you go. Now you can't complain, right?
Yeah,
So,
I'm
you
I'm
know, my
I'm the I'm the
she is the woman.
I'm the
There you go.
sacrificial one female.
Right. So, you're right. I don't know what it's like to have a period or a uterus, even though I've, been around it enough and operated on enough to at least have a good concept of understanding, but that's fine. With that being said, I let my mastermind give her story and
And I
answer
also
those
don't think like a
questions.
doctor, so I
Right,
give the
exactly.
patient perspective because sometimes we just think it's two totally different worlds.
Facts.
So I don't think like a doctor, but um, I take good advice. When it makes sense, I take good advice. All right, so I'm
Absolutely.
gonna kick it off with something that's submitted, and I saw somebody just say I have a question. If you have a question, please drop it in the question bubble with a question mark in it, and I'll be going back and forth between what was submitted and what is in the screen. All right. All right, so the first question, is it advisable to do a laparoscopic, no, yeah. Is it advisable to do a laparoscopy ablation before you do a frozen embryo transfer to get rid of bleeding? And also what causes the embryo not to implant?
All right. I'm gonna try to work that question out. So I think there's some confusion. Um, so a laparoscopic ablation, which I guess you guys would be talking about Excessa, which is a laparoscopic radiofrequency ablation. And the question is it advisable to do that before a egg retrieval?
Embryo transfer. Is that what?
An embryo transfer. Got it.
Frozen,
So, okay.
frozen embryo
So,
transfer.
yes, so you will want to do that first. So you will want to deal with the fibroid first. In any circumstance, you want to deal with the fibroids first before you do an embryo transfer. So for everybody else, like trying to put that in layman's terms, taking, taking, do you deal with fibroids first before you take eggs from a woman, mix it with the sperm outside of the body, have a embryo, then implant it back in the uterus? So this person is asking, do you deal with the fibroids before or after that process? And my answer to that would definitely deal with it before. You want to deal with your fibroids before because your fibroids are the hindrance of pregnancy in some cases. You definitely don't want to do a surgery after you have implantation. Once you do implantation, and you have, an embryo transfer, that's delicate, highly expensive process. You don't want anything disrupting that. So you want to have a very stable and prepared uterus that has been treated for fibroids, have had fibroids removed, had an opportunity to heal before you have before you have transferred an embryo into the cavity of the uterus for pregnancy. I think that answers that question.
And then they said also what causes an embryo not to implant.
Multiple things can cause the embryo not to implant. Um, It could be, hormone levels in a woman's body. So if you just implant it there, it doesn't mean it is going to stay there. There are a lot of physiologic things that have to happen for an embryo to stay viable and actually start to prosper and grow inside the lining of the uterus. It has to have the correct balance of hormones. Hormones have to be increased. That's why often when you have um, uh, IVF cycles, IVF treatments, there's a whole host. That's where the cost is. That's where the cost of the entire thing is not the actual getting the egg and mixing it with the sperm and creating fertilization. It's more so implanting it and then um, mimicking or recreating what the normal hormonal environment is supposed to be in the body to keep that newly implanted embryo prosperous and alive and growing, because this is really like, artificial pregnancy, if you will. Your body is not like knowing that this is happening. So once it happens, you have to really recreate the environment to keep everything viable until your body can take over, the placenta is formed, and other hormones can be produced to keep everything viable. So, yeah, it's a very, very fine balance. It's a lot of different things. You also have genetic abnormalities, chromosomal abnormalities that just, embryos that go through the maturation process and start to divide with their cells. Sometimes it's abnormal, just like in any other type of pregnancy. And your body, people wonder about miscarriages and those things. Like your body has um, a tendency. It's a physiological gift that we have as far as natural selection. If things are not going to come to fruition, your body may expel that early, or that's how kind of miscarriages happen. A lot of them happen. It's just from a non-viable thing that's happening in the body, and your body kind of rids itself of something that's not going to come to fruition, if you will.
All right, next question. I believe I'm perimenopausal, but I have an IUD. So I really don't know about my period. I don't want to take it out because it stops my cramps and my bleeding. But I am concerned about menopause symptoms and what to expect in this next phase in my life.
Um, the IUD is not going to prevent menopause from happening. Menopause is going to happen whether you got the IUD in there or not, because menopause is just a product of how the ovaries are working. So as the ovaries start to decline, which in every woman is going to happen, these symptoms can occur, and that IUD is not preventing the decline of the ovaries. Um, it just isn't. You just, as far as, whether you keep the IUD or not, it's an age thing. It's multiple factors in it. Um, at some point, it's going to have to come out. I mean, and you definitely have to talk to your doctor as far as, when that right time frame is going to be to take it out. But can bleeding be an issue after you take your IUD out if you're perimenopausal as opposed to postmenopausal? Yes, it can be. But with all of that being said, it still is going to have to come out at some point. But if you're worried about menopause per se and the symptoms that come with menopause, the IUD is not stopping that. And I wish I could, give some type of comfort about menopause and how that process is going to happen. But I tell my patients like this. Um, with menopausal symptoms, hot flashes, vaginal dryness, all those types of things, um, look at it this way. There's three things that can happen in a minority of patients. Like if you give 100 patients, maybe 10, 15 of them may have it to where they go through menopause and they experience nothing. Like it's just a walk up, just no more periods, maybe a rare occasional hot flash, but they go through it and don't skip a beat. Overwhelming majority of patients, probably more like 70, 80%, and these numbers I'm just throwing out there is just from my personal experience. I honestly don't know the exact numbers. I should do, but I'm just going from my experience. The overwhelming majority of these patients are going to have, um, you know, occasional hot flashes, maybe some vaginal dryness, um, you know, things that are happening that are not really going to impact the quality of life, meaning that you could still do your normal activities and not really skip a beat. Um, that's the majority, the overwhelming majority of patients. They don't really need medications. Things happen. It may be a little inconveniencing, but life goes on the way they're supposed to. Then you got the other small subset of patients, or maybe another 10% of patients that um, have horrific hot flashes. They cannot function. That you know, they can't sleep because they sweat, and they wake up in the middle of the night. They can't get comfortable because they have a hot flash throughout the day. They can't have sex with their partner because there's so much vaginal dryness. That's a small subset of patients. And that's what mostly everybody is scared of. But when you look at the overall totality of patients that go through menopause, every woman, not even patient, but every woman that goes through menopause, because every woman's going to go through it, it's a very, very, very small percentage of those women that have to have hormone replacement therapy, to have just miserable times with menopause. Where you fall in in one of those three categories, have no idea. Right? Every woman is going to have to experience one of those things at the end of the day. But I see women all the time come in and let me see my labs. I want to see if I'm, let me get my menopausal labs and I want to see if I'm in menopause. It's really pointless. It's going to happen. There's nothing that you're going to be able to do to stop this process from happening. You just got to deal with it when it comes, so trying to find out, am I in it or in it? Every woman is in it. From the time you start having your period, you are getting, it's just like death almost. Like we all are living and getting closer to death. Every woman is moving every day, getting closer to menopause. It just is what it is. It's part of the life process. So I wouldn't necessarily be fearful of it, but just be more mindful of how to counteract it when it comes.
All right. So if you're just joining and you have a question, please use the comment box with the question mark in it to drop your questions in there. You're more than welcome to talk to each other, say hi, stuff like that in the regular comment box. But if
All
you
of
have a question, please put that one in the one that has a question mark in it for questions. All right, next on the list. I have a cyst that hasn't ruptured within 6 months, but I was told it's benign. Should I be concerned?
So my first question would be, how do you know that it's just been there for 6 months? Because cyst, again, what we've talked about before. So ovarian cysts are natural, right? Every woman that is of reproductive age is going to have ovarian cyst because every time you ovulate, you release an egg, and it starts off as a cyst and it ruptures and releases an egg. If you ultrasound any woman of reproductive age at the right time of the month, she's going to have a ovarian cyst. So when people throw out the term ovarian cyst, it kind of makes me cringe. It's not you as the patient, it's more so us as the provider, and the people that know better, or sometimes they don't even know better and don't know themselves. But being able to explain to you that cysts are not always bad, and it just because you hear the term ovarian cyst does not mean that a bad thing is happening. Cysts that you need to worry about are cysts that are growing abnormally, that are greater than 5, 6 centimeters, that are, causing you to have pain, that's causing, issues, pain with sex, those types of things. Those are cysts that you need to worry about. But if there's a cyst that's there, that's stable, that ultrasound wise looks normal, it's not much to really worry about per se. Something to keep an eye on to see if it's not a physiologic cyst, to seeing if it's a pathologic cyst, meaning that there's something that's making it bad, and watching it. So I wouldn't necessarily worry about, oh, it was a cyst on this ultrasound 6 months ago, it's a cyst now. That's not so much a concern. It's more so, what does it look like on ultrasound? Does it look like something that's problematic? Is it giving you pain? Is it giving you type of issues? Those are the things that you really need to look out for, and understanding what ovarian cysts mean. Don't hear just ovarian cyst and run with it, because there is so much misinformation and miseducation as far as like what ovarian cysts are and what's normal and what's not normal.
All right. The next question in the chat: what are your thoughts on Lupron, especially if the largest fibroid is 10 centimeters?
Great question. And I've had this question come up with patients that call for consults all the time, and I hear providers that are really just throwing Lupron out, and it also makes me cringe when you talk about fibroids. So I am not a huge proponent, meaning that I do not necessarily agree with doing Lupron for fibroids, and I'll tell you why. Uh, and so there are instances in which Lupron should be used, and in retrospect, Cola, honestly, I should have gave you Lupron. You know, for you, I should have gave you Lupron. And what Lupron is good for is if you are getting a hysterectomy, meaning you have excessively large fibroids. I mean, really, really, really large
And you
fibroids.
say me.
Yes, I'll say you because you already know. So if you have excessively, I'm gonna say excessively and look you in the eye. So if you have
I
excessively
feel
large
seen.
fibroids, yeah, you are. If you have excessively large fibroids, and you're trying to keep this a laparoscopic surgery, meaning small incisions to get that mass out, the Lupron will help shrink that down, right? Shrink some of the fibroids down to make surgery easier as far as fibroids are concerned. And that's only when you're talking about hysterectomy, right? When you're talking about myomectomies and preserving the uterus and removing fibroids off of the uterus to preserve the uterus, I strongly disagree with using Lupron. And the reason why is because Lupron is a medication that's going to cause fibroids to change, like the composition. It's going to make them smaller, but more importantly, it's going to make them softer and make them more mushy. So when fibroid surgery the beauty of it is, like, fibroids are really hard, and you just basically remove them and popping them out of the popping them out of the uterus. But when you give Lupron, it's like trying to get a jelly-like substance out of a muscle, and it becomes real messy. It becomes difficult to shell out fibroids. You can leave more fibroid tissue behind. It makes fibroid surgery or myomectomies much more difficult. So that's why I don't recommend using Lupron, for fibroid surgery. In addition to that, Lupron is a medication that you can only use for a very limited time, from 12 to 18 months in patients. So if you don't have a very specific reason for using it, which for me only, would be if somebody comes in with a very, very large fibroid uterus. We're talking 32, 34, 36 week size uterus that I want to take out laparoscopically, and I want to shrink it down so that I can remove the uterus completely, then it makes sense. But if I have that same size uterus and I'm trying to preserve it and do a myomectomy, I definitely don't want to use Lupron. Not to mention it definitely has side effects. It's basically putting you into a menopause because it shuts your ovaries down. So then you have the side effect issue that could come from Lupron too. So it's not. I will be very honest. I'm very transparent with you guys. And I don't care. It might be providers on here that like, he shouldn't say that or whatever. I don't give a damn. A lot of times people give Lupron because they don't know what else to do. They are uncomfortable handling your surgery. They really don't want to give you surgery. They want to shut you up. They just want to, try to make things better temporarily, and hopefully, you just kind of go with it and go away. So therefore, Lupron is a medication that kind of band-aids things up and kind of scoots you on your way. But any true fibroid surgeon or what have you that's really, that understands the pathophysiology of fibroids, they're not really a big proponent of Lupron. No, it's not a good medication to use for what we're talking about. For endometriosis, absolutely. That's a whole different story. And somebody was talking about endometriosis. Yes, Lupron is a miracle drug for endometriosis, but that's a whole nother topic. The question was specifically for fibroids.
So maybe my butt wouldn't have got scratched up.
I still don't know what the hell happened with that. I have nothing for that one.
All right. So somebody just dropped in the comments, yes, I got your inbox, so I see you here now. So I'm going to go to your question. My periods have been irregular since 2017, and I have no idea when I'll start, as opposed to always getting them like clockwork. I also have fibroids, and is it possible that they are affecting my cycles?
Yeah, fibroids can be affecting your cycle, but I say all the time, fibroids, um, they always are to blame when people are having issues with their cycles, and again, the problem is us and not educating and not understanding, right? And a lot of times women will have pain or have bleeding or what have you, and you do an ultrasound, they have fibroids, and the provider will automatically say, yes, the fibroids. And you as the patient, the only thing you could do is believe what your provider is telling you. But knowing and seeing so many fibroids and understanding what fibroids do and what they don't do, I can safely tell you that if fibroids are really not pushing into the cavity of your uterus, then chances are they're not causing significant bleeding, meaning that whatever your bleeding is, you're having heavy bleeding just because that's your body. And I don't know, I haven't seen the ultrasound, so don't quote me on this because I don't know who you are as far as to be able to see everything that's in your case. But I'm just speaking from a general perspective that when you are looking at fibroids, you could have a 40-year-old woman that has horrible fibroid disease, that has, fibroids the size of melons, and is bleeding excessively and having horrible bleeding. And you can have the same 40-year-old woman that's similar demographics, the same age, same body type, same race, same amount of kid, you name it. You go down a whole list and they are very similar and have the exact same bleeding profile, bleeding, 2 weeks out of every month, using pads and tampons on top of pads, and have the same type of bleeding profile. But then you ultrasound her, she has absolutely no fibroids. So that tells you that fibroids are not the only thing that can cause you to have bleeding. As you get older, there's a physiologic thing called anovulatory bleeding, meaning that as your ovaries start to decline and start to fail, they don't ovulate regularly, right? So you don't ovulate regularly, and therefore you can have abnormal bleeding just from that, right? And as you get closer to menopause, your body just is confused because you're not having regular ovulation, and you can have bleeding from that. There are a ton of different things that could cause bleeding. Medications, different pathology that's in the endometrium, other things like polyps. Like there are a ton of things, adenomyosis, endometriosis. I can sit up here and tell you a ton of things that could cause bleeding other than fibroids. So just because you have fibroids does not necessarily mean that they're the reason why you're bleeding. You need to get with somebody that understands and is skilled to be able to tell you whether or not a fibroid surgery or fibroid intervention is going to fix your problem. I see way too many times. I can't count the number of times where I see a woman that comes in or is getting surgery performed on her that has abnormal bleeding, that's getting fibroid surgery for really non-problematic fibroids, and is being promised that her bleeding is going to improve because somebody's dealing with her fibroids because she really wants her uterus, and then after the fact she still has bleeding, right? So don't let that happen. Definitely do your research. I tell y'all all the time, do your research as far as your providers, and listen to logic. People should be able to break things down to you so that it makes sense to you. It should be talking over your head. Everything that they're saying should actually make, even if you don't have any idea what is going on, like certain things will sound right to you and not correct. Really do your research and understand what's happening. Man, and when it comes to fibroids, you got a whole bunch of quacks out there. I don't care. I call them out. It's a bunch of quacks out there that's doing quack surgery, that's giving quack advice, that's just telling y'all to just go get UFEs or uterine fibroid embolization because they can't operate, right? Telling you that you got to get hysterectomies because they don't have the skill to take out fibroids and preserve your uterus. It's quacks. I don't care. Like, y'all know I don't give a damn. Like, people can say whatever they want about me, but I pull the curtains back and expose frauds, right? Because I don't want to see my people going through unnecessary surgeries and going through stuff that's crazy. But unfortunately, I can't say the world. People don't listen to me all the time, and this stuff is not shared all the time either. It's like I urge y'all to share this stuff with everybody. It's 80% of Black women have fibroids, so it's like if you don't know somebody, if you don't have fibroids, somebody in your family, somebody everywhere has it. Share this information. And I'm not saying that I am the god of it. I know I'm good at it. It's other people that's good, but get with somebody that knows what the hell they doing, what they talking about, man, because women are getting punished out here. I mean, punished. And it's sad. It really hurts my heart and soul to hear a woman call me after saying she was forced to have a hysterectomy, or she went to 2 or 3 doctors and they tried to get her to have a hysterectomy. It's just bad, but I can only save, try to save as many as I can. I think somebody trying to get on here, Cole.
Okay.
Hold on, let me see. I tried to let her on. There she go.
Hello. How you doing?
I'm good. How you doing?
I'm fine. So I'm the one who had DM about the fibroids one from 2017 when I was saying that I've been having a regular period since then.
Just the question
She had
you just answered.
Yep, the question.
Yeah. Refresh me a little bit more, because I get a whole bunch
So
of people.
basically my period's been irregular since 2017,
Okay.
and I don't know when I'm gonna.
You DM
Yep.
Cola.
I don't.
Okay.
Right. This is a question she just asked.
Gotcha. Okay. All right.
Mm-hmm.
So what is your ultrasound like? Do you have your ultrasound report by chance?
No, because I have it with me. I don't have it with me right now. I don't have it with me right now. So I just
Gotcha.
know that they I just been having, in 2017 my periods was irregular, and then 2018 is when I had the ultrasound, and that's when I first found that I had them.
Mm-hmm.
And then they told me I had them before that, but they never did let me know.
Gotcha.
So it's just I never know when my period is gonna start. I might have it 1 month, And then I might go like 3 months without it, or if I do have it, I might bleed for like a little over a month or
Hmm.
like for a few days. Like I literally have to carry it past me all the time because I don't know when I'm gonna start my
How old
period.
are you?
42.
And when did this start happening?
2007,
In 2017.
2017,
So
in
that's
October.
5, 6 years ago. So it's been consistently
Mhm.
like that
It's been
since then.
consistently like that. I mean, yeah, like pretty like I said, I always got to take a pad with me everywhere I go because I don't know when I'm going to start.
And before that, it was okay.
It it was regular, like coming like clockwork until like 2014. Like I 2 times in 2014, I didn't have like a period for some months. Then after that, it was regular
Hmm.
until 2017,
Gotcha.
and then ever since then, it's been like that. And then in 2019, I think I was going through
Hmm.
perimenopause because my estrogen was getting low. It was different, down in my
Who took?
vaginal area.
Why they tell you your estrogen was getting low? Come in, because it's not. If your estrogen getting low, it stay low. It's gonna stay low. So that means
Oh,
your estrogen low now.
okay, well, whatever I was going through, I don't know what it was, but all I know is my body has never experienced nothing like that before. So it scared me, and I got my estrogen levels checked. And I'm sorry because it's like I'm not at home, so I don't
Yeah.
have
No,
like my
I
papers
get
with
it.
me. So yeah, but yeah, it scared me. So I just, everything changed.
Got you.
But like got better.
Right.
So
Right.
I guess I'm just a fool with my periods. I don't know like if I should like get surgery because I don't know when I'm having a period. I don't want a hysterectomy.
Where you at?
I'm in
Where you?
Kansas City, Missouri, but I'm willing to, drive
Got you.
forever.
So,
'Cause,
so
yeah.
reach out to me, because I need to look, because I don't want, like, that's one thing about me. I don't like to. It's I'm educating people, and you brave enough to come on here. So, with that being said, I definitely want to help you. But I don't
Okay.
want to tell you. I don't want to tell you nothing that's off the wall either.
Right.
So for me to really tell you the truth and what's happening with your body, I need a little bit more information.
Okay.
I definitely need that ultrasound to be able to
Okay.
see, ask you a couple other different questions, and I'll do that for you.
Okay. And
But
I make it like
what
I'm sorry.
you say?
You can come on.
Say it again.
Can I make like a consultation with your doctor's
Just
office or
DM me. So since you were brave enough to actually
okay.
come on there, I'm not
I
gonna
know.
charge you. I would
Oh
just do
yeah.
it for you. So that's
Okay. I
I true
appreciate
to
it.
my word. So
Okay.
just DM me and I'll look at it for you. So
Okay.
um and but just listening, and this is for everybody. So I just kind of like want to talk to everybody. When I'm listening to you, like things are going on in my mind. And if I were just to bet without looking at anything, I would most likely say that you're going through what's something called anovulatory bleeding. I would venture to say that it's not fibro, it's just really doing this to you. It's your body's response to aging, right?
Okay. Mhm.
With that being said, you don't necessarily, as long as fibroid disease is not rampant, you don't have a whole bunch of other issues. There are other treatment options for you,
Okay.
that are well short of a hysterectomy, that can fix it. If this is just run-of-the-mill bleeding, there's other options that you have. So we'll go over those things. Um,
Okay.
Another thing that I want to throw out there for everybody that's listening too is that, and I've been having this problem as far as uh, now that I'm in a new practice, left another practice or whatever, and patients are getting records. This isn't for you, this for everybody. When you go to a doctor's office or you go to
Mhm.
a hospital, do not let anybody tell you that your records are not yours, right?
Right.
You paid for them. Your insurance paid for them. They are yours. Don't let somebody say, "Oh, I can't send this or I can't whatever." When you go and request your stuff, your
Mhm.
records, which you which I encourage every, now man, woman, child, everybody to have a copy of the most pertinent. You don't need all of your entire records, but the most pertinent things like your lab values, your ultrasounds, MRIs, those types of things, the reports of those things, they are yours. Do not let anyone lie to you and tell you, "Oh, we can't give it to you. It is yours." It is actually really unlawful for them to do that. You can get sued for not, handing a patient their information. So don't be afraid to ask for your stuff and to be able to keep it in handy, because when you do get to a person that, or get to a provider that really can help you, they have to be able to see certain things, or otherwise you're going to have to undergo additional tests and additional stuff that's going to cost you money and be inconvenient as well. But just back to what you were saying, that's what I would initially say, honestly,
Okay.
is that it sounds as if you're having something called anovulatory bleeding. Now, mind you, it could be a bunch of different things. It could be
Right.
endometriosis, adenomyosis, polyps. It could be a bunch of different things. But because the change happened kind of quickly and it's been
Yeah.
persistent over this time, I would probably venture to say that it's not a fibroid that's causing you to do that. You probably will get different opinions about it, because if I ultrasound, you probably have a fibroid.
Yeah.
You're having bleeding. You're having
Right.
bleeding. So it's easy for me to say the fibroid is causing your bleeding. You need a hysterectomy. It's very easy for
Okay.
me to say that. It's more financially advantageous for somebody to tell you that, but it's not addressing your problem and your particular
Yeah.
situation, your wants, your desires, and all of those types of things. So just be leery. That's for everybody that I'm
Okay.
talking to. Be very leery about people telling you, giving you advice that's not coinciding with what you want and what is specific for you. It's not a cookie cutter method for everybody. Everybody's different, and everybody has different options. Just like,
Um,
Cola had different options. If Cola really wanted to keep her uterus, she could have. I wouldn't have told her that
yeah.
she couldn't. It would have been difficult, but she could have kept her uterus. She was just at a different place in life where she was like,
Right.
to hell with it. I'm done.
Yeah.
Like, I don't. You aren't there. You guys are a similar
Yeah.
age,
Yeah.
black women or
Mhm.
what have you, but you have different lives. So me to tell you that
Mhm.
because she has fibroid, she has to get a hysterectomy. You got fibroid, you have to get a hysterectomy. It's criminal. It doesn't make any sense to do
Yeah.
that. But just reach out to me. I'll definitely
Okay.
help you. I'll look at your stuff and I'll give you, an honest opinion about what you need to
I
do.
appreciate
You're
that,
welcome.
and I'll inbox him tomorrow.
Okay.
Thank
All right.
you.
And yeah, and if you
Okay.
could just have your ultrasound or whatever. So
Okay.
when you send it to me, like send me just the reading. I don't need the pictures or whatever. I just need the
Okay.
reading
Just
of what the ultrasound says.
reading.
Okay?
Okay.
All
All
right.
right. Thank
You're
you.
welcome.
Thank you, caller.
Thank you. You're welcome.
Thank you.
Yeah, she wasn't sure if she was going to be able to join live, so that's why I said I'll at least ask one of the questions.
Somebody else tried to join. You want to ask another question before I let this other lady up?
No, you can let them in.
Okay. Thank you.
Hello?
Hello.
Sorry, I'm trying to get my camera
It's
on.
all right.
My name is
It's a
Micheline
nice chair.
Wilson. My name is Micheline Wilson. I'm calling from the Dutch
Look at that.
island of St. Martin.
Did you reach out to me before? Did we talk?
I was trying to message you because right now I was out of work from last year
Uh-huh.
because my blood count dropped to a 6.9 because I have fibroids. And my gynecologist, he is letting me know, look me here. Okay, hi, Happy
Hi.
New Year's, everyone.
How are you?
He is telling me I'm very, very, very emotional. They sent me to Colombia to do the urine embolization, and I didn't did it
Good.
because I prayed first. I said, God, if these people have to touch me, let them touch me. But if they don't have to touch me, let them send me back home. They did not touch me.
Smart. Good.
What they did, they wanted to operate and take out. I said, no, my insurance didn't send me down here for you to operate me. My insurance sent me down here for you guys to do
To
the
evaluate.
urine. Yes, you guys doing something. But you see, because they are Spanish and I know Spanish too, they thought I was just only speaking English. So when the doctor started to, oh no, she have to take it out in Spanish, I respond to him in Spanish. And I said, no, I didn't came for that. Then my friend that was down there with me, she told me about you. She said, this doctor told her, don't let no one tell
Yeah, she
You that
said
you
that's
have
why I
to
say
see
it's some it's
me.
another, yeah, she reached out to me.
Yeah,
I
Gail,
said my yeah,
Gail,
yeah, yeah,
yeah,
Gail did.
Gail,
Okay.
yeah.
Yeah, Gail was cool.
Yes, and she
Yeah.
told me that you need to reach to him. My stomach is huge. It's huge. I'm like I'm pregnant.
Gotcha.
You understand? And I'm 39. I've been suffering with fibroids when I was 35.
Hmm.
And they was telling me, oh, just take it out. A doctor even turned and tell me, I said, but I am heavily bleeding. And the French gynecologist told me no one's supposed to be able to touch me when I'm heavily bleeding. The
False.
Dutch doctor turned to me and tell me, well, you have to take out your womb. You have to take it out. And I was so emotional. I was so hurt. I was crying. And he was like, yeah. I said, but I could die with you doing me this. And
Sure.
he told me, you know what he told me? He told me you could walk outside and get hit by a truck
Jesus.
and you can die. This hurt me. I am home right now. Tomorrow, tomorrow, life sparing. My insurance company sent me back out to work, and my blood count is a 6.9. My house doctor, he was like, "No, they're crazy. They cannot send you back out to work with you." Sometimes I have to be like this to see because I feeling dizzy. I don't know if you could see my hands. I'm anemic.
I see it. I see it.
I just finished had my period. I bleed heavy, and I'm just emotional. And I was telling my friend Gail, I said I need to reach out to this doctor. I want to know what can I do because I know I want to make another child. I have 2 sons, but I want a girl. I mean, I'm not. What's the chance for me having a girl? Yeah, but I don't want to take out my womb. I just turned 39. I'm gonna be 40. I had my menstrual when I was 10 years old. So what they basically telling me down here, oh, you had your menstrual when you was 10 years old, so you're going to hit early menopause. Anyway, so just take it
That's not
out.
true. That's not
This
true.
thing hurts me.
It's so many things. It's so many things that you said that just reiterate what I'm talking about. So the things and people think like, oh, well, she's in St. Martin, and those are just doctors that no, it's doctors that are worse here in the United States, right? Like they're bad doctors all over the place, So don't get it twisted. Like the stories that you're talking about there are stories that I hear from women that are here. And just like I told Gail, like, no woman should be told that she just has to have a hysterectomy, right? Unless, now mind you, for cancers and things like that, to save your life, to remove it, okay, that's a different story. But
Yeah.
if for fibroids or benign fibroids, no woman should be just told that she should have to have her uterus removed. Um, and I don't have do you have your ultrasound handy by chance, like
Yeah,
a report?
they gave from Colombia. They gave me the ultrasound, but I was looking to see how I can connect to you because she told me basically what you said that we should go and get
Hmm.
so that you can look at it. But I have my lab results and the lab, and it's like it affected my job because my job was like, hey, you can't
Gotcha.
continue like that. Just take out your womb. Everybody's just, and
Right.
I like, yes, I'll take out my womb when you have your testicles removed. I just reached to a point like, you guys don't tell me what to do with my freaking
Right.
body. It's my body. I'm fighting for my womb. Just like when the doctor told me my tonsils don't mean nothing. I said, no, my tonsils mean a lot to me because I look it up.
Absolutely. It's your
You
body.
understand? And look today, I still have my tonsils.
So this
It
what I want
hurts.
this what I want you to do. So Gail has like my personal email and stuff. So because she sent me her ultrasound. So I want you to do the
Uh-huh.
same thing. So get my
I'm gonna
email
get it
address.
from her.
Yeah, get my email address from Gail and send me your ultrasound results so that I can see
Okay.
and then
And tell
send me
me how
and
much
no,
I have to.
no, you don't have to pay nothing because you did this and you were able to be brave enough to actually hop on here and tell your story, then I'm going to do it for you for free. So just send it to me, send me your contact information, and then I'm gonna reach out to you and we'll talk about it.
Okay.
Okay?
Thank you a lot, Doc.
You're
Thank you,
welcome.
guys. Thank you very much. This is a real relief for me because down here is like I don't have hope. I
No,
don't have hope.
I,
It just remove it. It's like just remove it.
yeah.
It's
So
nothing.
and
And
that's
it's something to
and
me because it messed it. Look, my aunt, she went and removed hers and her weight just going up, she can't have it controlled. They do
and
not know
and
how much it
fortunately enough,
affects your body.
so fortunately enough, and I'm trying. Well, the reason why I just signed with, and this is for everybody that's on here. The reason why it took me so long to sign on to a practice and get another hospital was because I wanted to get to a place that one, would be very attentive to my patients, and two, it's very important for me to not have to deny anybody procedures and surgery. So I'm at a hospital now that's a nonprofit hospital that that makes it affordable for people without insurance and people that are underinsured. They don't turn anyone away. So with that being said, I don't know, and I don't want to get too many hopes up because I'm new to the system, so I'm trying to figure out. Because I have patients that have called me from women that have called me from Canada. Now, like some in the Middle East, I've had now like in the Caribbeans, like I've had women call me from other places. So
the Caribbean is full of that,
right.
huh? A lot of us have that, and we're getting the same talk,
information.
you know?
So if I can possibly, I honestly don't know what the cost out of pocket is going to be for you. I don't know what the options are. I will definitely work with you and Gail to try to get you guys here to operate. You know, I definitely want to help you guys. So I don't know the answers.
I talked to my insurance, I talked to my insurance. I told them about you.
Yeah.
I tell them if they can link up with you and thing, and they told me, oh, we would only pay what Cali, Colombia call for. I said, but Cali, Colombia is different to what this guy is saying. This guy is the fibroid slayer. he more specified in the woman's body. Cali, Colombia, they only saying the same thing you guys saying because they only seeing how they know about me because you guys send my records to them. That's the only way they know. They didn't really do nothing with me. I was like there for on vacation, and plus I get robbed. Yeah. How you like that? Me being sick in another country that I never know, and I get robbed.
That's crazy. That's crazy. Well, look, so I want to help you and Gail. I would love to have you guys up here so that I can help you because you guys
definitely will promote you. I definitely will promote you to stay because I have a lot of young girls walking around with no womb because they told the same thing. They don't even have kids. They just take their womb out.
If I could save everybody, I would. That's what I'm trying to do. So
maybe God sent you. Maybe he was a God sent. I think he's a God sent.
I hope so. I hope God. I ask God, you know, just to use me, and to give me and first of all, thanking him for giving me the skills and the ability to be able to do this and the knowledge to do it and get to this position, but then also to giving me the ability, like just financially, to not really be money hungry and all that, and just humble myself to help people.
But then if you're worth the money, don't shortcut yourself. If you're worth the money and you could save as much womb, I'm down for it because this is only happening in Black women, and that put something in my head. I'm like, why is it only happening to Black women? Because Black women breed more.
Yeah, it happens here too. I mean, you think it's bad there? Like, look at it, man. United States is horrible. Like I keep telling women all the time, you can go to some of these doctors if you want to, but it is a fact that 2/3 of all, that means 67% of all hysterectomies are done in southern states, which are, you know, Republican states, where racism was the most rampant. Is the reason. Like at one point, for black women, it was called the black woman's appendectomy. Yeah. Meaning that they considered it as, you know, just like taking out your appendix. That's how they considered taking out Black women's, you know, uterus.
Yeah, because basically they're saying we're overpopulated. We're our race. We make the most children. We poor, but we make a lot of children.
Yeah, it's hatred, it's racism, it's ignorance.
That's because, and then remember these doctors, the gynecologists. I have to speak like that with them because I don't think they know what they're doing. Yeah. I have to call them out like funny. They ain't really gynecologists. There's this how you say? Destroyerists. Because for you to tell somebody that is emotional, this is my womb. Yeah. These hurtful things, it's hurtful. I cried. I cried. As you can see my face, like I have these little things breaking out all on my skin because yes, I'm stressed, and that is one of the biggest things that cause the fibroids to grow when you're stressed in, you know. And the doctor that I'm dealing with, he's black, but he's on his own because the white one sent me to him, the white Dutch man, doctor, send me to him and say, well, don't go to none of my colleagues, go to him. I went to him and he's messing around the same way. And they know that he's not 100%.
So your own people. Don't get into it. Like I be telling people, it be black doctors too. They horrible too. So it's bad.
Yeah, that's what I'm trying to say. Yeah. But the Dutch actually, racism is everywhere, but the Dutch will show you. Because, like I'm saying, I'm from the Dutch side of the island. You know, they would call you zwart. You know, zwart mean black in Dutch.
Yeah, you know. So when I visited there, I was in the Dutch side too. So, so do this for me. So, send me your ultrasound. Send me how to contact you. Like I said, I've already talked to Gail too, and I told her the things that we can do to try to get this to happen. So I'm gonna try to work with you guys and see what I can do to try to get you up here to help you.
Okay, no problem. I will ask her for the info. And then
info. And if not, just DM me. Just shoot me a DM.
On message. Instagram.
Yeah, on Instagram. Shoot me a DM, and then I'll answer it, and we'll go from there. Okay.
Okay, no problem. Thank you, doctor. Thank you. I don't know your name, but thank you, Miss
Cola.
Thank you. All right.
All right. Anybody else trying to join?
Yeah.
You hot tonight. I told you I got more requests in 1 week than I did.
So it's like, oh, it's free. Oh, it's free. Let me have my ass over here.
I'm brave tonight.
I'm ready.
The surgery is not free. The consultation.
Surgery's not. Yeah, it's like, and again, man, I told a patient today, it was like, it's not me like getting rich off of these things. I do other stuff. I get paid more from teaching somebody a surgery and watching it than actually doing it. I actually lose money doing these surgeries, so don't think for a second I'm just sitting back hard trying to get all these patients in so I can get rich. I promise you, there are other things in my life that I could do that will give me more money than to sit up there operating on somebody for 3-4 hours. So it's genuinely to really help people. It's not for anything else. It's definitely not a financial gain for me. Please believe it, especially with patients that have public aid insurance and all that, man, they are not giving pennies on the dollar. No. And they don't care if I'm in there. They don't care if I'm in there an hour or if I'm in there 5 hours. They don't give a damn. Nope. They're like, yep, here go $10. You just took a whole carburetor out of human. We don't give a damn. Good job.
And I have good insurance, and I saw the bill, and I saw the itemization, and mine was 6 hours, 6.5 or whatever, and they still paid you less than everybody else in the room.
On the thing. Right, exactly. Right, so it's a real thing. It's a travesty, but it's like I didn't get into it, for that. So you're welcome.
I did appreciate it.
You're welcome. You want to ask some more questions? You want me to let this lady in? What you want me to do?
Let them in, and like I said, if I have to, I'll screenshot because I'm telling you, the list is fire.
All right.
You work.
I mean, we might have to come out and like restart it.
Okay.
Possibly.
Do that.
Hello.
Hello. Hi.
How are you?
Hi, Dr. P. Hi, Cola. I've been following you forever.
Awesome. How you doing?
So I've got a question. I'm due for surgery in 2 weeks.
Okay.
I'm kind of at a crossroads. I'm 33 years old. The surgery that I'm due for, she wants to do a myomectomy. Okay. I apparently have endometriosis, and it's not 100%. It's just like an assumption.
So she doesn't. It's not a sure diagnosis that you have endometriosis.
Exactly.
Okay.
And that's an assumption based off MRI. I have 3 large fibroids, but one of them is like 10 centimeters, and it's pedunculated. Okay. So she's suggesting she's
That's the
changed
that's the
her.
that's the that's the easy one. What do your other ones look like?
Where are they? The other two, like really huge ones, like ones I just know that it's on the ones on the left, and
Okay,
um, I'm not too sure. They're inside the actual womb.
got you.
So
I would guarantee you that you got more than three though. But go ahead.
yeah, yeah, for sure. Yeah. So basically, she's changed her surgical plan like twice on me. The first time she said she'll cut down like below my belly button. The second time she says she's gonna do like a full like halfway down. Um, and that's basically because I know. That's what
Already.
I know.
Say no. Don't do it.
Okay.
Please, what Andre 3000 say? Please reconsider. Read the literature.
That's exactly why I'm so afraid of doing this surgery, because I'm like, I don't want a top down cut. I mean, her reasoning is like, she's saying that you have endometriosis and I need to get behind there, but it's not confirmed that I even have endometriosis.
Get your purse.
Yeah.
I love
Yeah.
it.
I mean, yeah, like, and I'll be honest with you, because I don't know where you located.
I'm in Florida.
Yeah, so it's easy for me to be. It's easy for somebody to be like, yeah, I can give you another excuse so I can really make the surgery easier for myself because
Mm-hmm.
you have a difficult surgery, right? You have a 10 centimeter fibroid is legit like that, and if that's the
Yeah.
biggest one, I'm sure you got a couple more that are like that. So it's difficult, but if you know how to do it, you don't have to. You do not have to have a vertical incision. I'm just sorry. People was like, you don't be hating. I'm not hating. It's I'm telling you the truth,
Yeah.
right? And if the
Yeah.
truth is hating, let it be. But vertical incisions, they hurt. They take longer
Mm-hmm.
to heal. They take longer to heal. Higher risk for infection. Higher risk for bleeding. And they're cosmetically unpleasing. That's just an incision that you're going to have to live with for the rest of your life. And the chances are, when you go, no, it's not even the chances are. When you go get pregnant,
Yeah.
they're going to ask you, well, do you want me to give you a bikini cut with an incision so now you got a big T, or do you want us to go back through this vertical incision and take the baby out through that? And you're going to be like, well, go back through the vertical incision. You're going to have to go through this process all over again,
Yeah.
and go through, the same risk and stuff just to have a C-section. So you are looking at two vertical incision laparotomies when you have this one, because once you get pregnant, you're going to do it again. So my
True.
strongest advice, no, you do not have to have a vertical incision because you have endometriosis.
Mm.
That is not the case. The vertical incision, honestly, is them doing it because you have big fibroids and they don't want to struggle with either one, they don't want to struggle, which is part of it, and then two, they really can't because they don't know how to manipulate to be able to do it through that. So they're just going to go and cut you up and down. And I'm, again, I do this for information, so you can take it for what you want, but there are providers, and I'm not the only one, but there are providers that will do this surgery for you with a small incision in your bikini line,
Yeah.
which will then can be used for your future C-sections, and the only person that knows that you had surgery is you and your
It's
spouse.
me. Mm.
So, or whoever it is, that you with like that and see you naked. Other than that, nobody else will know that you had, had surgery, or that should they know that you had surgery. So think about it.
Oh yeah, of course.
It's just think about it. But I'll tell you right now, if your question was, well, do you have to do that because you have endometriosis? My answer to you is emphatically no. That's not
Okay.
true.
So I
Especially
did
if she
go and
says
get
she's not sure you have endometriosis.
Right.
yeah,
If you're not sure, then you
exactly.
can't tell me you got to do it.
Mm-hmm.
Correct.
Exactly. So I did go and seek out a second opinion like 2 weeks ago. And well, you've
So they
answered the
told you the
question.
same. They told you the same thing, probably. You did what
No,
did what they say.
Well, he suggested me going on Lupron or this other drug that's similar to Lupron, and then do it laparoscopic or vaginal.
So you
So
just
that was
you just heard all of my reasons why that's not a good idea either, right?
yes, you already said it.
Right. So
So okay.
I definitely would do a laparoscopic myomectomy on you either. You know, again, you're obligated with those size fibroids. They've changed the architecture of your uterus. You're going to be obligated to have C-sections in the future. It makes more sense to do an incision that's going to be cosmetically pleasing, and it's
Mm-hmm.
going to be able to give you the advantage of removing all of your fibroids and being able to be utilized for your future C-sections. It makes much more sense to do that.
Oh, okay, I see. Brilliant. Thank you so much.
You're
You've
very
answered my
welcome.
question.
Thanks for hopping on, and good
Yeah.
luck.
Thank you. I just got to
All right.
find a surgeon that will agree to do that. If I don't know how I'll get to Chicago.
It's a no, it's nothing but a flight, mama. It's easy. People do it all the time.
Okay.
You can get up here.
I know it's my insurance. They won't cover me for
Who?
Chicago.
So and that's what I say all the time. Don't let your insurance limit you, right?
Yeah.
We're at the tail end of open enrollment. So if you needed to, you just change your plan. You know, it's going to cost you for 6 months to a year to get
Hmm.
a PPO plan that allows you to travel, but to get the surgery that you want, to pay that makes sense. And it's not coming out of pocket for surgery. It's just paying the extra 100, 200, $300 a month that you need to do
Yeah.
for to get the plan and then go get the surgery you need.
Okay. Thank you so much. I'm gonna
You're
look
welcome.
into it.
All right.
Thank you. Bye
You're
bye.
welcome. Bye bye.
All right, so looking at time, we probably at the 5 minute mark. So if we get cut off, we just gonna restart, right?
Okay. Yeah, we can restart. Yeah, we can restart. Everybody want us to restart?
Well, yeah. If people want us to restart, we can
Yeah.
restart.
Yeah. Put a little heart in the thing and say like, yeah, we want y'all to keep going. Or if it's been too long, then we can call it a day. But go ahead.
All right.
What's the next question?
The next question is, sorry, I got to go to the bottom. It's a lot in here. Okay. I went to my gyne a while back. I had small fibroids, nothing major, but I kept having pain in my lower abdomen. I've gone through menopause at 37. I still am having pain. Could it possibly be GI related issues?
Absolutely. You know, pain, there's not always pelvic pain, abdominal pain is not always gynecologic, right? So it could definitely be GI, so there, Crohn's disease, irritable bowel syndrome, ulcerative colitis, diverticulitis. These are all conditions of the bowel that can cause pelvic pain as well too. So, a good primary care physician and a good gynecologist working in tandem will be able to pinpoint where your pain is coming from. But somebody should give you a full workup to see. And if you don't have much on ultrasound, you've done other kind of gynecologic checks and you still having persistent pain, then absolutely the next thing you need to do is to find, get a GI workup to see if it's from a GI source.
All right. The next question. What is your input on bidets as a woman? Sometimes I wonder about the cross-contamination, for lack of a better word.
I've never, have I ever used a bidet? I think I used one time. Um, it's isn't it fresh water that goes up and then the water goes like the dirty water goes out? You don't have like recontamination of water that comes from the toilet up. Like doesn't it like isn't it a whole stream system that comes up and then goes out? I don't know enough. I'm the first to tell you I don't even know. The answer to your question is if it's fresh water that goes into your bottom, it's not a problem. If it's recycled water, then yes, that's a problem. As far as the water is concerned, unless you are spraying spreading things open so that water can go into your vagina is not a problem. You know, that water is really external and it's hitting your like perineum, the part that's on the outside of your vagina. It's not a true problem. It's not going to cause you an issue unless you are in there trying to take, you know, something to kind of douche or go inside your vagina. Then it's a problem. But other than that, I don't think bidets are a big issue.
Okay. Next, what age do you recommend you should stop having babies?
That's a tough question. Um, I really don't. There isn't a real age that I say that you shouldn't stop. I think that the older you get, the more cautious you should get. The older that you get, that there are an increased risk of complications of pregnancy. But I don't think there is an age in which you just say, no, you should not have a child anymore. Once you get into your 50s, and then it gets a little murky at that point. And then a lot of uh, fertility specialists are not going to do fertility treatment over women that are 50 and over. But I have delivered women that are, I think the oldest woman I delivered was like early 50s. So it happens. Women get pregnant in their 40s, can have healthy pregnancy, healthy babies. People think this whole term of geriatric pregnancy, which is the dumbest term in the world, it's not a true term. Don't listen to geriatric pregnancy. There's no such thing as a geriatric pregnancy. There's a term called advanced maternal age, which is after 35. But advanced maternal age does not mean that you're old. It does not mean that you can't have a normal pregnancy. It does not mean that you can't have a healthy child. It just means that you need to be more cautious, that you should have obstetric intervention early and during your pregnancy, and that you should, you know, be as healthy as you possibly can going into pregnancy and do the proper things throughout pregnancy to decrease your risk of having an abnormal pregnancy. But there is no particular age. If you can spontaneously get pregnant on your own, if you can, meaning you can have sex and get pregnant as long as you want that child, and as long as you have a close relationship with your OBGYN to be able to get early care, then I don't really necessarily have a cutoff of when a woman should stop. Your body will naturally say this is enough. You'll not be able to get pregnant when it's time for you not to be able to get pregnant. And whenever God decides that, so be it. But I don't think it's for any man or woman to tell you that this is the age you need to stop. You 44, you too old. Nobody should tell you that. I don't believe in that. I think that's trash.
All right. Would you recommend a hysterectomy after an ablation that resulted in atypical cells?
Ooh, that's a good question. Wow. Um, yeah, who asked that one? That's a good one.
They DM
They
me,
did,
so I have to go
Angie.
back and look at the name.
That's a good one. Um, in short, yes, I would. If you have atypical cells after an ablation, well, pause. If they're talking about atypical cells of the cervix, right? Which
They didn't say
that's
that
what it
much.
sounds like. That's what it sounds like. So you can have atypical cells from multiple places. You got atypical cells in the endometrium. You can have atypical cells in the cervix. So it sounds like, I think I misunderstood in the beginning, but it sounds like they had an endometrial ablation, which is burning the lining of the uterus, and then they had an abnormal pap smear, which is atypical cells of a pap smear. For that, as long as it's not advanced dysplasia, meaning that it's like, you know, CIN 2 or 3, or like, advanced abnormal cells of the cervix, then no, you don't necessarily need a hysterectomy. But it really just depends on what the level of abnormal cells or dysplasia is to make that recommendation. If you're very close to cancer and you've already had an ablation, yes, remove it. But if it's just some abnormal cells on the pap smear that are, typically a benign thing, and you had an ablation, I would not recommend just getting a hysterectomy just for that. No.
All right.
And there's somebody else trying to hop on
Okay.
here. We're gonna get cut off in a minute, huh?
Well, we passed the mark, so I don't know.
What is it?
Instagram
Is it an
might be
hour and a
being.
half? What is it?
I don't. It be an hour
I think
sometimes, and then
it's an
sometimes
hour and a
it be
half.
tripping.
Hi, that was my question.
That was your
So I
question?
wanted to jump in. Yeah, I'm 45, about to be 46.
Okay.
I was on birth control, but my blood pressure went up, so they didn't want to give me birth control anymore.
I wouldn't do it either
Yeah.
given your age. Absolutely not.
So the birth control was to help with my heavy bleeding. So I was advised to do an ablation. So we did an endometrial ablation.
Mm-hmm.
He also performed a DNC, and
Mm-hmm.
that was sent off for pathology, and that came back with the atypical cells. And his thing is, since he didn't see any polyps or anything when he was doing the ablation, he doesn't know where the cells would be. So he doesn't want to try to just use ultrasound to just monitor to make sure that
What
those cells don't
type of
become cancerous.
atypical cell? So he did a DNC and then did an ablation.
Well, he said that's part of his standard care. He did the
So he should. So
ablation.
honestly, and this is a part of the thing. So if you have abnormal bleeding or you have abnormal uterine bleeding uh, after 40 years old, so this is for everybody. When I'm talking for everybody. So if you are a woman, well, a woman clearly, where if you have abnormal bleeding after 40 years old, especially African American women, you should have either some type of endometrial sampling, whether it be an endometrial biopsy or a DNC. And these come before doing a procedure. So if you were coming to me and you came to me with abnormal bleeding, you're 45 years old, number one, I would not give you birth control pills. I wouldn't give it to my mama. I wouldn't give it to my auntie. I wouldn't give it to anybody that I love. I'm not doing birth control pills. Is there can it be? It's not 100% safe. Birth control pills are not 100% safe for anyone, right? However, it's a
Mhm.
risk versus benefit. It's a very, very, very low risk. The older you get, the risk increases. It increases slightly, but it still increases. So at post 40, if you are still having abnormal bleeding, I'm not giving you birth control pills or anything with estrogen to control your bleeding. That's number one. Number two is if you are over 40 years old and you're coming to me saying I'm bleeding 2 weeks out of the month, I'm bleeding, I'm having these heavy periods or whatever, right then and there I am doing an endometrial biopsy first. And that endometrial biopsy is going to tell me what if you have abnormal cells that are in your endometrium that cause you to have bleeding, which you did. From that point, then we have some decisions to make. It is not indicated to do an ablation when you have abnormal cells, right? With that being said, it's already done. It's already in the wash.
Mhm.
It's there. So with that being said, from there, I strongly recommend you have a hysterectomy. Yes, because even if it's not cancer now, you have absolutely no way of monitoring it and following it to see if those atypical cells are going to progress. If they progress, you can have a cancer and you don't know it. And by the time you figure it out, it could be well too late. So if you got atypical cells from your endometrium off of a DNC and then had an ablation, I would definitely move on to do a hysterectomy for you.
Okay, thank you. I wanted a second opinion because I was trying not to do hysterectomy, but I don't want to just be sitting there waiting for something to
I get you.
progress.
Now, with that being said, you can do a laparoscopic hysterectomy. You be out of the hospital in 24 hours, be back driving your car, doing everything within 2 weeks. Okay? So,
That's the plan. I
the,
scheduled a hysterectomy, but I just wanted to make
yeah,
sure
you're doing
before.
the right thing. You're
Okay,
doing the right thing.
thank you. I appreciate you all.
You're
Thank
welcome.
Thanks.
No problem.
you. That's good that they hop on to clarify.
Mm-hmm.
Okay. Are there true health benefits to sleeping without panties on at night for women, or is this just an old wives' tale that your vagina needs to breathe at night?
It doesn't necessarily need to breathe. Um, I wouldn't recommend doing very tight underwear. You want loose fitting garments, right? Because you can't increase your risk of yeast infections and things when you have very tight fitting garments. And then also too, when you sweat at night, it can harbor bacteria and things. So is it better to sleep without panties on? Yeah, it's better technically, but if it makes you feel comfortable, it's if it's a comfort thing, then yeah, you can sleep with undergarments. I just recommend to not sleep in very tight undergarments. You either like thongs and things of that nature. Like, yes, you know, definitely give it some air. And when I by mean giving it some air, I mean, you know, don't have, don't be sweating and have an increased risk of bacteria formation and things like that. But comfort is key. If you're comfortable wearing underwear, wear underwear. Just wear loose fitting underwear.
Okay. Question in the chat. I have endometriosis and fibroids. I've had 2 LEAP procedures, heavy cycles, debilitating cramps, and recently my gyno suggested I have a partial hysterectomy. I'm 39. I'm recently widowed, so I'm not sure I want to go through with the suggested treatment plan. What would an alternative be?
You got a lot going on. Yeah, so leaps, you have abnormal cells of your cervix, with endometriosis, um, and she said she had an ablation.
No, 2 LEAP procedures, but she has heavy cycles and debilitating cramps.
An ablation is a possibility for you to treat the bleeding, but you still may have debilitating cramps. It may help you with your bleeding. If your pain is from bleeding, it's probably going to decrease, but it's also a possibility that you may still be in pain. But the bleeding can be addressed with the ablation, but it's more concerning that you've had 2 leaps. You really have to stay on top to make sure that you don't have more dysplasia or more abnormal cells of your cervix. That's more the concern than anything else that she just said. So no, the answer is you don't necessarily need a hysterectomy, but it should not be taken off the table as an option. It should definitely be an option, but you don't necessarily need one. And when people say partial and complete and all that stuff, it makes me cringe. So you guys, hysterectomy is a hysterectomy. Don't say partial. If your doctor says partial, I won't say smack them, but just educate them and tell them removing my uterus is a hysterectomy. Removing my ovaries means something else. Use correct terminology, because they telling y'all bad terminology and people running with it. So they just basically told you you're just going to get a hysterectomy and keep your ovaries, but it's just not the right term. Removing your uterus, removing your cervix is just a hysterectomy, or a total hysterectomy. But you don't, again, I guess to answer your question, you don't necessarily need a hysterectomy, but I wouldn't take it off the table as an option. I would look at all of the options and weigh them and see exactly what you want with your life and what you need, what have you. If you're not trying to get pregnant, if you're done with your fertility, then hysterectomy should be put on the table.
All right. Can you explain more about
Explain more about what?
Is it pudendal,
A
P-U-D-N?
pudendal block?
It says pudendal nerve.
What about it?
Okay. They said, is it true a doctor can push it while delivering a baby so the woman can't feel pain? So I don't know if they spelled it right or not.
Can't. No, that's it. Can't push it so you can't feel the pain. You could do something called a pudendal block, which is basically putting an anesthetic, or injecting a local anesthetic around the nerves, around the pudendal nerves, and that's intravaginal. So it's basically you just take a long needle and you just inject an anesthetic around the pudendal nerve, which will help with pain with delivery. It's another analgesic or another way of giving a patient an option for pain management, other than epidural or in addition to an epidural. Yeah, but it's not pushing on it. You could push on it all day long. It ain't gonna do nothing. You actually have to inject some medicine there to numb it, so that it can alleviate the pain.
All right. Do you have any thoughts or advice about LICHEN, lichen? Is that lichen?
Lichen
Okay.
sclerosis.
Yep. That's exactly what it says.
They said, do I have any advice?
Thoughts or advice?
Definitely watch it. It can progress into other things. So a low potency steroid treatment is the first line treatment for it. But be wary, if you start to see changes in it. Well, first of all, make sure that you get an official diagnosis with a biopsy and make sure that's all that it is. Make sure that it's not lichen planus. If it's not a neoplasia or some type of cancer, make sure that those things are ruled out first, before you start just treating them with steroids and stuff. But my advice is to watch it. Watch it. You could treat it with low dose steroids, but watch it to make sure that it isn't changing and that there's something more advanced growing. That's my advice. Go to your doctor. Always have your doctor be you be on the lookout. Any changes, let your doctor know ASAP.
All right. I think I got everything in the box tonight. Submissions go on forever and ever, so this might be a good stopping point so we don't get cut off and we don't have to resume. But we're going to keep going anyway, so.
All right.
I think this might be a good stopping point.
I think it's a good stopping point, too. I think we did a lot. We accomplished a lot.
And you definitely reached a lot of people tonight, all over the country.
All over the country. Look at that. All over the world. Look at that. We international.
Right.
International.
Partner.
So that's cool, everybody. So like you said, any questions y'all want me to address or whatever, y'all send them to Nicola. Sometimes y'all don't want to ask me. Y'all definitely want to ask her. That is perfectly fine. She talks to me all the time. I'll answer them the same. So, send all inquiries to her. Don't send them to me. I got my DMs be flooded with all type of stuff. It will get missed. So she is the keeper of the question and the moderator of this. So, send them to her. But thank you guys for being attentive and tuning in. I hope, people were helped. Share it with folks, please. Don't have us just sitting over here an hour and a half and have all this good information and you just be selfish and keep it to yourself. Please share it.
And I do also always put our recordings on YouTube as well. So if you have somebody that doesn't have social media that would like to benefit from this content, please feel free to share. So it's available. It's free. You don't have to have an app. You don't have to be on social media, so they can see. And, you just never know who could be dealing with the same thing.
They do. I'll be like, people they know you. Call you like a superstar. She's like, I follow Cole. I was like, oh, okay. I'm one of Cole's friends. I was like, oh, all right.
Some people be name dropping that don't know me. You'll be able to tell the difference. Some people be stretching it a little.
I bet.
So be real leery, because I had somebody that was like, well, can you just tell him to call me directly? And I'm like, I don't know.
Man, I swear, people be thinking I'm on all type of time. I'll be like, man, I'm just one person.
I'm just going to tell him that I know you and he'll give me his number. And I was like, that ain't how it works, y'all. Sweetheart, that ain't how it works.
So I guess we do it in a couple weeks.
Just be leery of some people. I'll vouch if I know them, though, for real. I'll even let you give you a heads up, like this a personal person. Take care of them. Yeah,
I'll take care of them. But yeah, so if we get a bunch of questions that we don't have to wait a month, we can do it in a couple of weeks. So we'll see how it goes. Other than that, we'll do it next month.
I definitely am down for that.
Okay.
we don't always have to wait a month. Sometimes it's just, I know we both be back and forth. So
very busy. Yeah. So we'll play it by ear. Y'all got questions? Y'all got stuff y'all want me to talk about? Just let us know. But other than that, y'all have a good night.
Thank
Thank
you
you for
always.
tuning in, being attentive, and we'll see y'all next time.
All right. Appreciate
All right.
you. All right. Thanks,
All right.
everybody.
All right.